sore after sex? We can help. Plus, dealing with a partner who has a higher libido. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thanks, Derek. Great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest who will give us some insight into dealing with sex addictions. But first, let's take a question.
Dr. Leah, a viewer wants to know, is it okay to improv with household items for lube and sex toys?
Household items can bring about a number of unsuspecting sex toys to spice things up in the bedroom. But you want to make sure that you're spicing things up safely. Use just a little bit of your imagination for sizzling up foreplay and reach for items like ice cubes, the vibration from a cell phone, a handheld shower head, the spin cycle of the washing machine, a clean feather duster for teasing your partner, and even a kitchen spatula, only on the outside, for tapping into different fantasies. For at-home lubrication, try safe options like alcohol-free aloe vera, olive oil, virgin coconut oil, plain yogurt, and even egg whites. I know this sounds weird, but egg whites works. Although it takes more of an effort to prepare, there's evidence that suggests it has a similar consistency to cervical mucus, making it for a pleasurable experience. Some at-home lubricants should always be avoided, and these include Vaseline, certain types of lotions, butter, baby oil, because all these may lead to an infection.
Dr. Leah, tell me more about these egg whites.
I mean, I think you really are adding whip 'em to it, and you don't want me to jump on that. All right, so no, it's not even that you're whipping up the egg whites. It's just that you could have them prepared, separated from the egg yolk and have them beside the bed. It just takes a little more prep time, but for people, if you're gonna pop a Viagra, might as well separate your egg yolks from egg whites.
And spice up foreplay with a spatula?
Well, and like I said, the spatula needs to remain on the outside because when you just say spice it up with a spatula, that can lead to a whole range of ways that it could be interpreted. It was more just like smacking, that type of thing, not inserting.
Egg whites, spatula, there are a lot of options.
Just remember, Derek, if anything makes you or your partner feel uncomfortable or if it's causing any pain, just stop. This isn't how much can somebody take section. You want to make sure that both people are feeling really comfortable and happy about whatever you're adding into the bedroom.
A woman asks, can anal sex cause hemorrhoids or other issues?
Hemorrhoids are blood vessels inside and outside of the rectum that can cause itching, slight bleeding, and sometimes pain. But it's unlikely that anal sex would actually be the sole cause of a hemorrhoid. Hemorrhoids are associated with straining, but typically that's the straining from outward bowel movements, not from inward penetration. What's more likely is for an existing hemorrhoid to become irritated after anal sex due to lack of lubrication and constant friction. While anal sex won't necessarily lead to hemorrhoids, it is important to remember that the anus is much thinner than the vagina and lacks natural lubrication. This leaves the anus more vulnerable to tears and potentially allows viruses and bacteria to enter the bloodstream. Remember, this can include sexually transmitted infections such as HIV. So when it comes to anal sex, it's important to use as much lubrication as possible, but also keep in mind that the anus was designed to hold in feces. Repetitive anal sex may weaken the anal sphincter, making it difficult to hold it in. Very important to note, though, the rates of fecal incontinence don't differ drastically between those who have anal sex and those who don't. So I'm not saying that you need to avoid anal sex.
So what are you saying?
Well, it depends. So I believe the numbers are that men who do not engage in anal sex are about 5% likely to have fecal incontinence versus 11 when they're repeatedly engaging in anal sex. With women, the numbers were different. It was only about a 2% difference. And without conducting the study, I can't guess as to why this is, but I'd presume it's men who are engaging in anal sex are probably engaging in anal sex very frequently, whereas women who are engaging in anal sex might also continue having vaginal sex and using it occasionally. But the percentage differences really aren't that great. It could potentially cause a fecal incontinence problem, but that's going to be over a lot of anal sex.
And you gotta use a lot of lube, right?
Yeah, I mean, definitely, especially when you're trying to prevent STDs and tears, because remember, the anus is not self-lubricating.
A man asks, what are some essential oils for ED?
Essential oils are widely praised for their relaxing effects, and you may be surprised to hear that they can even help with erectile dysfunction. Whether you use the oils on a hot or cold compress, mix a few drops in a diffuser, or massage the oils onto your abdominals or low back area, there are many different essential oils that can help you connect with your partner and promote intimacy and arousal.
So you're saying essential oils really work?
While some essential oils have been found to treat depression, frigidity, and anxiety, oils like ylang ylang, rose, and lavender are also said to deliver euphoric properties. That's right, these oils can help bring about happiness and self-confidence that can aid in sensuality. Other essential oils like rosemary, lavender, basil, ginger, nutmeg tend to reduce stress, but they can also promote blood circulation and increase sperm motility. Essential oils can certainly help with ED. However, remember, it all begins with leading a healthy lifestyle. Remember to eat well, exercise often, and get plenty of rest.
Do essential oils with medication work?
Yeah, and again, you're going to have to check with your MD to see if there's going to be any conflicting effects there. I don't know any conflicting effects with erectile dysfunction medication and any essential oils, and I don't see there would be any reason. But whenever you're mixing anything, you always want to make sure that it's definitely safe.
Still ahead on Sex Talk, the benefits of morning sex. Then, an addiction expert highlights the signs of a sex addiction. Also, find out the connection between sex and headaches.
Waking up isn't the easiest for everyone, but there are some real benefits to starting the morning with sex.
Waking up to morning sex may be better than coffee. While sex can be a stress-free way to start the day, it can also be the ideal time to connect with your partner. When you wake up, several hormones are at their peak. Testosterone levels can be highest in the morning. And while testosterone helps build muscles, it's also essential for stimulating sex drive and sustaining erections. Levels of other hormones, like estrogen, are also higher in the morning. These hormones are important for libido and sexual arousal. But that's not all. One study found that blood flow to the genitals increases, specifically during the REM cycle, which is the sleep cycle that occurs before waking up. The increased blood flow in the genitals can lead to better performance and more pleasure. And while you may feel groggy in the morning, you likely have more energy compared to after work or late at night. With increased hormones and blood flow, the morning is ideal for peak sexual pleasure. Plus, the inherent benefits of sex can be a great way to start the day.
If you feel like mornings are a bit too early, like they are for me, you may want to consider your routine and try waking up earlier. It could be worth it. Coming up, we have a special guest here to offer tips on dealing with sex addictions. Plus, we will help you navigate sex during menopause.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. You can find out more about Sex Talk at AskDrLeah.com.
Welcome back to Sex Talk. I'm here with Dr. Donna Marks, an author, mental health expert, and certified sex therapist. Thanks for joining us today.
Thank you for having me on your show.
So let's talk about sexual addictions. What are some of the common ones that affect people in their relationships?
Well, the two most common right now are pornography and then infidelity.
Okay, so at what point do these behaviors become harmful?
Well, any addiction is defined as continuing to do the same thing despite negative consequences. So someone might use pornography occasionally and not be addicted to it, what happens for the sex addict is that they prefer it over actual intimacy with their partner. And so then it becomes a problem because it's not having a fulfilling relationship with your partner, it's having it with the pornography instead.
So what do you think are some early signs that maybe a partner could recognize in seeing whether or not their partner had a pornography addiction?
Well, I recently worked with someone, and she noticed that all of a sudden her partner did not want to have sex. And before that, they were having sex on a regular basis. And so she started looking for clues and found that her partner was engaging in pornography. He said he would stop, and he didn't stop, and she noticed that things were better for a while, and then they got bad again, so she could tell that he was back into it. And the problem is that people often have better orgasms when they're not having to focus on someone else, and then they up the game on the pornographic sites, and then they even sometimes start meeting people outside of the marriage, which leads to the second part, infidelities. Sometimes infidelities are affairs, sometimes it's just for sex and nothing else. So it can really escalate to a very serious condition.
Yeah, and I know a friend of mine actually experienced that with her partner, and she felt really insecure, and then turned to plastic surgery and all of these other things when that wasn't really the issue. It was, rather the addiction to pornography.
Yes.
So how does someone manage that sexual addiction in a relationship?
Well, you can't manage an addiction. It manages you.
Yeah.
So that's the first thing, is to recognize that you have a problem and that you need to get help with it. And sex addiction is probably one of the very hardest addictions to treat, because it's like food. You don't stop doing it, hopefully. And so learning how to replace that addictive behavior with loving sexual behavior can be the challenge. First of all, the person has to want to have a normal sex life, and to be able to heal whatever's driving them to be addicted. I believe that every addiction is a substitute for love. I talk a lot about this in my book, and to learn how to replace the addiction with actual loving experiences for yourself and for your partner.
Nice. So what are some tools that you use to work with your clients?
Well, first thing, to try and understand what's going on. I mean, someone doesn't just develop a sexual addiction. There's something going on underneath that. And often it stems back to a person's childhood, but not always. But so we want to explore that to make sure there's nothing in there that needs to heal, that's perhaps some previous trauma or some type of identification with sex objects instead of sex being about sharing and receiving physical intimacy with another partner. And so, or even with yourself. I mean, young people have natural, normal, experimental behavior. So we want to explore that. And then once that's addressed and dealt with, to be able to help people to learn how to have sex in an emotionally and physically satisfying way.
Okay, wonderful. So, in the instance with the person that I knew, like, what advice would you give to somebody, let's say that they recently discovered that their partner has any type of sexual addiction, whether it's pornography or meeting with multiple partners on the side? What advice do you give to the person once they've found that out?
Well, first of all, don't blame yourself or the other person. Try not to attack. Try to come from love. Let's deal with this together. But whoever has felt betrayed by their partner, you need to deal with your pain about that. You can't just bypass that and let's logically approach this from a healing perspective. So both people need to address their own emotional aspects of this particular addiction. And then if they're willing to work on it together to get the right kind of help, to be able to heal, because it is a betrayal. It is an affair outside of the relationship, even if it's with a machine. It's a secret, it's interfered with the relationship, and it's a violation of trust. Sometimes people don't care, so that's a whole nother issue, but you're asking if someone has found this out and they didn't know it, and they didn't ever agree that it was okay. So then to be able to, heal that trauma together, to be able to say, let's try to figure out why this is going on. If it's an addiction, the person's going to need to go maybe to a recovery. There's lots of 12-step meetings. Sometimes people need to go to treatment for sex addiction. There's a couple of really good places here in the States for that. And then to be able to see a therapist who specializes in addiction.
Okay. Well, thank you so much for joining us. And stick with us. We'll be right back with more Sex Talk.
Coming up on Sex Talk, what to do about soreness after sex, how menopause can affect your sex life, the connection between sex and headaches, and ways to avoid yeast infections, and much more.
We're back here on Sex Talk. Now let's get right to the next question.
Dr. Leah, a 53-year-old man wants to know, why do my legs hurt after sex? I just started having issues getting sore after sex. What can I do?
Don't worry, feeling sore after sex can be normal. During the arousal phase of the sexual response cycle, it's common for the muscles in the body to just tense up. The good news is this tension is usually released when partners have orgasms. But if partners are aroused for a really long time, or if they're holding their bodies in one position for a while, which often happens, they might find that their muscles begin to feel really sore. And again, this is usually normal, and that soreness should go away in a day or two. For women who may feel sore after sex, it's important to ask yourself and evaluate, what exactly are you feeling? Sex can certainly leave you sore afterwards, but it should never be painful. While there are many reasons that you can feel sore, like lack of lubrication, lack of arousal, really rough sex, or an allergy to condoms, it could also be more serious, like a sexually transmitted disease, endometriosis, or a urinary tract infection. Don't be shy or embarrassed about any pain or discomfort you may be experiencing. If your concerns worsen, or if the pain is worsening, it's definitely important to discuss the symptoms with your doctor.
So feeling sore after sex, is it like feeling sore after the gym?
Right, so if your penis is sore, that's typically going to be different than if your quadriceps are sore, for example. Now, if you've been having sex with the same partner and you're just having a wild, fun, rainy day and you're both sitting around and having a good time and you have way more sex than you usually do, okay, then the penis can be a little bit sore there. But if you just had sex with a new partner, wasn't necessarily prolonged, and you start to feel soreness in the penis, then I'd be concerned.
A question from a woman. She says, I'm going through menopause and I just don't have the desire for sex. I love my husband and he's been so good to me. I really want to please him. What can I do?
If you're going through menopause and you've noticed a change in your sex drive, good or bad, there's a perfectly good explanation for this. The loss of estrogen and testosterone may not only lead to changes through a woman's body, but can also lead to an increase or decrease in sex drive. If you're one of the lucky ones whose sex drive increases after menopause, this may be due to less anxiety or fear linked to pregnancy, which typically allows women to relax and enjoy intimacy with their partners. But if you're experiencing the opposite, which is quite common, you're not alone, nor does it mean that you love your partner any less. To break it down simply, lower estrogen levels cause a drop in the blood supply to the vagina, causing sex to be uncomfortable. And frankly, uncomfortable sex is just unappealing. If that's the case, try water-soluble lubricants and take into account the different medications may cause sleep disturbances, stress, bladder control issues, and all that can also lead to intimacy issues. So in going through this new stage of life, be kind to yourself. Be open with your partner. And remember, you can still show your partner love and affection without having sex just by simply enjoying time together. Take walks, eat dinner by candlelight, or give each other back rubs. You might also want to try switching up your routine a little bit. Experiment with different types of foreplay, erotic videos, or books. Just ensure you're getting plenty of exercise to help boost your mood, and also talk to your medical provider about any medications that you're taking that may be dampening your intimacy.
You know, what I liked was, he is so good to me. What if she fakes it?
I always think that's a really bad idea because it's, first off and most importantly, dishonest. But how is he going to know if he's doing the right things to please her if she's faking it? That's just going to be even more confusing for the male. So I think men often want to please a woman. So the best thing in this situation is for her to accurately communicate what he can do to please her so that she's genuinely getting that pleasure, and then he's going to feel better about it in turn.
Should she talk to him and bring him in on it?
Yeah, absolutely. And I mean, when in doubt, if you feel uncomfortable, you could always make it clinical and provide the research like, this is what's happening to my body. You know, I'm not alone. Help me through these stages. But absolutely, open communication is going to be the best.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk Go to AskDrLeah.com.
Does sex cause headaches or can sex help with headaches? We have the latest research.
Research is uncovering the link between sex and headaches. While some people may experience headaches from sex, others may find sexual activity brings relief from their headaches. When we experience pleasure, our body produces endorphins. So when we have sex or an orgasm, endorphins are higher and have been known to block pain. One study with migraine patients revealed that 60% of patients had improved migraine symptoms with increased sexual activity. In other cases, sexual activity has been shown to trigger migraines, sometimes referred to as orgasm headaches. Some people may experience headaches during or after sex. These types of headaches can last a few minutes or several hours. A lot is happening in our bodies during sex that can lead to a headache, including a rise in blood pressure or heart rate.
There are a lot of ways to relieve a headache, but definitely talk to your doctor with ongoing concerns. Before we go, let's take on a few more questions.
Dr. Leah, a woman asks, why do I always get yeast infections after oral sex?
This is a great question. Oral sex introduces bacteria from your partner's mouth into your vagina's ecosystem of bacteria and yeast. Yeast thrives in moist environments, so oral sex creates an opportunity for that yeast to grow more quickly than it normally would, resulting in an uncomfortable yeast infection. If that's not bad enough, there's more. If your partner continues on to kiss you or lick other parts of your body, then this bacteria and fungi can spread anywhere up into your mouth, nipples, and anus. Yeast infections can be pretty uncomfortable, so talk to your partner about the issue and use methods like condoms or dental dams, which minimize the spread of infection. You may also want to minimize your risk by wearing breathable cotton undergarments or just wear nothing at all. Again, we're trying to eliminate a moist environment for yeast to thrive. However, keep in mind oral sex and undergarments are not the only culprits for causing yeast infection. Birth control, antibiotics, breastfeeding, pregnancy, even fragrant cleansers can all contribute to the symptoms that you're experiencing. In the case that you do have a yeast infection, don't worry. There are over-the-counter creams that have been proven to provide relief, or you can call your healthcare provider for an oral one-pill treatment.
Is there anything that can limit the amount of bacteria in the mouth?
Well, definitely good oral hygiene is going to reduce the amount of bacteria that is spread. So that is incredibly important. And frankly, it's just sexier if somebody has good oral hygiene for anything that you're doing in that area. So brushing your teeth can be helpful. There are instances of thrush where there's an overproduction of yeast in the mouth. That's typically not common in people that have immune systems unless they're compromised. I actually did have a roommate that had it due to far too much fake sweeteners, but when I say far too much, I mean like she was consuming 1,000 packets a day. Like your Diet Coke is fine. That's not gonna cause this problem. So it can occur in other instances where you've got heavy yeast in the mouth, but it really just isn't all that common.
A man asks, how often do you need to get tested for STDs if you're in a monogamous relationship?
Here's a fact that may surprise you. Even if you're in a monogamous relationship, it is recommended to be tested for STDs at least once a year. As long as you're sexually active, you should be getting tested. Some STIs that are commonly included in STI screening are hepatitis, bacterial vaginosis, HPV, which is tested through a pap smear, herpes, pelvic inflammatory disease, syphilis, and gonorrhea. So if you're experiencing any strange itching or burning or any other worrisome symptoms down below, you should see a doctor to figure out what's going on. And even if you're symptom-free, you should know how often you need to get tested and then actually do it. Just keep in mind, when caught early enough, most STIs are treatable and even curable. Those that aren't curable may be managed once you know you have them.
You know, if I talked to my wife and told her I want to get tested, she would not be happy.
Well, it's interesting. I actually did that because a friend of mine was teaching in a class, and I guess a student had tested positive for HIV. And so I was in a long-term relationship and said, hey, we weren't tested before we got together. We should go do this. And he was like, is there something I need to know? I'm like, no. This is why I was concerned. It just got in my head and it helped me sleep better. And everything was fine. It was great, but it did help me sleep better. So it was good to know. Unless you were tested right before you got together, then I think there's always a reason to be concerned.
What resources can our viewers use to get more information?
Well, there are a lot of different resources out there. The CDC is one that'll give varying recommendations. Any public health department will also give those. And typically, and it's important to remember, you can get all of these testing for free, depending on your site. Now, your doctor might not test you for free, but there are a lot of public services out there that will provide free STI testing. But that's all the time we have for today. You can still send in your questions. I'm Dr. Leah Janine, and we'll see you next time when we answer all the questions you've always wanted to ask on Sex Talk.